Hi everyone, my name is Amy Shafer and I'm the Speech Language Pathologist Clinical Fellow, long-term LEN trainee. And today I'm going to be presenting my systematic review, which explored the use of Autism Spectrum Disorder diagnostic assessments delivered through telehealth. So here is my HRSA disclaimer. A critical barrier to early detection of autism spectrum disorder is limited access to screening and diagnostic services. Telehealth offers a potential solution to accelerate the diagnostic process and ultimately increase access to appropriate intervention services. Telehealth can reduce barriers such as time and resource constraints, including travel expenses, work hours lost by families, and the number of clinical visits needed. For these reasons, previous research has explored the feasibility and validity of using telehealth for children and families living in rural and underserved communities. However, since the COVID-19 pandemic occurred, clinicians across the nation have now shifted from providing in-person gold standard diagnostic assessments to virtual telehealth platforms to evaluate all children suspected of autism spectrum disorder. This has really expedited the transition to telehealth service delivery models, but has also left many clinicians, including myself, scrambling to navigate how to appropriately assess for autism through telehealth with limited evidence-based practices. So the purpose of this study was to identify diagnostic and screening tools used via telehealth, to discuss the feasibility and validity of these measures, and to highlight the key findings. Lastly, my goal is to identify advantages and disadvantages of using telehealth for the purpose of diagnostic assessment. So I conducted a systematic review to explore synchronous telehealth diagnostic assessments for individuals suspected of autism spectrum disorder between the ages of birth and 5. But for more information on the databases searched, keyword search string used, and inclusion and exclusion criteria, please refer to the handout that I've provided you all with. A total of 381 articles were originally found, but after duplicate articles were removed, there was a total of 239 articles, which I reviewed by title and abstract. 209 articles were excluded during this process as they did not meet my inclusion criteria. I read a total of about 11 articles, 3 of which were then excluded as they used asynchronous technologies. And then of the final 7 articles, 3 were systematic reviews and 4 were pilot studies. So as you can see here, these are the diagnostic assessments and screening tools that had been administered through telehealth. Of the diagnostic assessments administered, you may notice that 2 are modified gold standard tools, so the ADOS and the ADIR. 2 are screening tools, the STAT and the TEDDY, and then 1, being the TEDDY, was specifically designed for telehealth. So based on the preliminary research, there is emerging evidence to support the feasibility of using synchronous telehealth diagnostic assessments. Many of the studies were also interested in parental satisfaction. And what they found is that all studies reported that parents found high levels of satisfaction with telehealth assessments. Research also found that parents could be coached to administer play-based assessments with their children when given appropriate coaching, either prior to and during the assessment. And lastly, these procedures were found to be more cost-effective for both clinicians and for families. And it significantly reduced travel times for families by a total of 4 hours. Many studies also evaluated telehealth diagnostic assessment procedures and how they could accurately detect autism. And so the results indicated that clinicians could accurately detect children with autism when assessed through telehealth, with high levels of inter-rater agreement between clinicians in the video conferencing setting and the in-person condition, with approximately 86% accuracy. There are also high levels of sensitivity and specificity when administering the ADOS and the ADIR in both the telehealth and in-person condition, which suggests that these tools could be used through telehealth. In terms of the diagnostic accuracy on the STAT, that is the screening tool for autism in toddlers and young children, remote clinicians could accurately detect autism in about 78.9% of cases, so that being 15 out of the 19 participants were identified as having autism and who ultimately went on to receiving an autism diagnosis in the in-person condition. In this study by Juarez and his colleagues, no children were inaccurately identified as having autism. And lastly, psychologists reported satisfaction with diagnosis, but would have liked to see patients back in person about 20% of the time. So administering diagnostic assessments through telehealth has many advantages, some of which include access to high quality services, reduced wait times for those in-person assessments, reduced travel time, work hours lost by families, and just all over expenses needed by the family. Telehealth is also cost effective for both families and clinicians, as I previously mentioned. It also provides clinicians with a unique opportunity to observe children in their natural home environment. However, telehealth also has many disadvantages. Families may not be able to access Wi-Fi technology or other things necessary for this type of diagnostic procedure. And if families do have technology, video conferencing may lag, making it difficult to have a conversation and to observe a child, especially things like eye contact, gesture use, and social imitation. Privacy restrictions and service reimbursement rates also make implementing telehealth assessments more challenging for providers. And right now with COVID-19 going on, there is a lot of restrictions lifted, which has made it a little bit easier at this time. Building rapport with families over telehealth and providing comfort and empathy throughout the process may be a bit more challenging when done through telehealth. And for parents seeking an initial diagnosis, it may be more anxiety provoking for them to really administer a play-based assessment as the clinician is observing them interact with their child. And lastly, telehealth assessments are likely to be insufficient for children who are presenting with more subtle or complex. And in these cases, it's really necessary that we see them back in person. So now I just want to go ahead and highlight that there are clear limitations to the systematic review that should be noted. So for one, the systematic review only examined synchronous telehealth approaches to evaluate young children with symptoms of autism. And I examined research published between 2010 and 2020, and this study only examined research conducted in the US and in English. Some of the studies I reviewed, most importantly, all pilot studies had small sample sizes. Some of the studies used gold standard diagnostic assessments, including the ADOS and the ADIR, and these measures were specifically developed and designed to be conducted in person and by trained professionals. In terms of the sampling procedures, many studies recruited families of children who had already had a diagnosis of autism or would subsequently receive an in-person assessment after the telehealth visit. And lastly, many of these studies lacked consistency and common practices in the procedures, with some using screening tools and others using actual diagnostic assessments. So in conclusion, one of telehealth's greatest strengths lies in its ability to increase access to high quality assessments. There is evidence to suggest that screening and assessing for autism through telehealth can triage waitlist times. However, for some children, particularly those, as I mentioned, with more complex symptoms, an in-person assessment is absolutely required. And overall, just more research, especially rigorous research, is needed on larger scales with randomized control trials to guide evidence.
So you want to grab that other pool and be my window wetter? Sure, that pool might not work.
Sorry, I'm hearing something in here.
Amy, can you please?
Sorry. Lastly, there is a clear need for more research to validate assessment procedures delivered through telehealth, examining the and specificity of these measures with larger sample sizes. It may be beneficial for future researchers to develop standardized protocols of parent training with these assessment procedures and develop effective approaches for training clinicians and parents with varying levels of experience on how to deliver these play-based assessments through telehealth. It may also be important for researchers to identify barriers that impact access to diagnostic services these in the future. Research is also needed to examine individual factors for us to really differentiate which children will need to be seen in person and which children diagnostic assistance to via telehealth. And currently, I just want to point out there is ongoing research by Dr. Warren and his colleagues at the Vanderbilt Kennedy Center who are conducting an ongoing randomized control trial examining an assessment for autism that was specifically designed for telehealth. As this is an ongoing research trial, it was not included in my systematic review as it did not come up, but I do want to point out there is a lot of promising research going on in this area right now. And I think in light of COVID-19, I'm really curious to see how our future practices will now change, given that we've been able to practice and use these approaches. So with that, that is the conclusion. Thank you all for tuning in.